there are numerous problems related to workplace conditions. As Marjorie has said, they can be related to the overload, the sheer overload that comes from downsizing and outsourcing and asking someone to do two jobs when previously they had to do one. It can also come from job ambiguity. In other words, the requirements of the job are not being articulated and clarified sufficiently by supervisors. And actually, one of the key things that we find in exit interviews of employees who leave, the single biggest reason that they give for leaving is that they did not receive good and positive feedback. And I don't mean in terms of you're not doing the job well. I just mean any feedback of any sort from supervisors. And everybody who puts out 8 hours plus a day of effort surely wants and deserves to have some sort of feedback. So these are fundamental human resources failures that many businesses are suffering from. Of course, when there's a plethora of people on the unemployment line, it's very easy to be cavalier about and not take seriously these kinds of obligations to workers. When job availability becomes tighter and people do not have, employers do not have that many options, that's when, of course, they start getting interested in how do I retain people. It's very unfortunate that there is not a culture of health, as Marjorie suggests, pervasive throughout our corporate environment. There are obviously some companies that do a super job, and unfortunately, many of those are major multinational companies that have the resources to be able to do it. What we need is also the encouragement and assessment tools and also the resources for small companies to also get into the culture of health game. Now, when you look at the cost, we're looking at about $30 billion of cost per year to U.S. business that comes from work days lost due to stress-related condition. And when you look further at the numbers, what you find is, as Bob has indicated, around about 36% of U.S. workers in surveys, generally speaking, give the indication that they are suffering from work-related stress. And very few of these workers have access to resources that can help them through their company. And even when those resources do exist, employee assistance programs, for example, many workers will not avail themselves because of the perception of stigma and the fear that if word gets back from however independent the EAP professional is alleged to be, the concern is that, in fact, that person will report back somehow through a reporting system and undermine the employee and their credibility in the workplace. And they may be passed over for a job, they may not get a raise, they may be the first person out of the door when the company has to cut the workforce. People are worried about the stigma associated with that. So these are just a few of the issues that are coming into play around mental health in the workplace. I would just underscore one point that I think is very essential to make, that about 1 in 17 people suffer from a really serious mental condition. And it's very easy to get sidetracked into putting resources into general mental health programs or general stress reduction programs, all of which are valuable and helpful. But let us not take our eye off of the reality of the 5 or 6% of the population who do have a very serious condition that can pose significant risk for an employer and for fellow workers as well as family members. And those people really need to be sure that they have a lot of attention paid to them.